Imagine you're enjoying your favorite burger, pizza, or biryani. Just a few hours later, you suddenly feel a sharp pain under your right ribs. The pain keeps getting worse. You feel nauseous. You start vomiting. A fever develops. Even taking a deep breath becomes painful. You rush to the hospital. The doctor examines you and says, your gallbladder is inflamed. You have acute cholecystitis. Acute cholecystitis is the sudden inflammation of the gallbladder, caused by a gallstone blocking the cystic duct. Think of your gallbladder as a small storage bag for bile. When a gallstone blocks the exit, bile gets trapped inside. Causes include gallstones, infection, trauma, and severe illness. Symptoms include severe pain in the right upper abdomen, fever, nausea, and loss of appetite. The most important sign is Murphy's sign. The doctor presses under the right ribs. Diagnosis includes blood tests, liver function tests, ultrasound, and possibly a HEDA scan. Treatment includes IV fluids, painkillers, antibiotics, and laparoscopic cholecystectomy. If untreated, complications like gallbladder perforation or sepsis can occur. Quick revision. Gallstone blocks the cystic duct, bile gets trapped, causing pain and fever, and positive Murphy's sign confirms diagnosis. That's acute cholecystitis made simple. If you found this helpful, like, share, and subscribe to MedGirl by Dr. Aria Khan.